One other thing to note on the Part D plans is pharmacy choice is a major factor in that certain plans are in network with pharmacies where others are out of network. Just as a example, I had a client who was on a medication that would cost them $5,000 at Walgreens and $40 at CVS.
Well, welcome back. Thanks again, Zach, for joining us. Today we get to talk about original Medicare. So there's a lot of fun topics in the world, and there's very few that are more scintillating than original Medicare. Really appreciate your diving in with us and getting your expertise on some of the complexity here. So as we talk about things up front, the ABCDs of Medicare, that phrase gets thrown around as just an explanatory way to think about the different parts of original Medicare. Can you kind of unpack just at a very high level, what the different moving parts of Medicare are?
Definitely. So when it comes to Medicare, I'm going to start with original Medicare. So that's going to be Medicare A and B. So Medicare Part A is going to be your hospital insurance. Typically, that's not going to carry a premium just as long as you've paid into Social Security's for 40 quarters, so roughly 10 years. And then your Medicare Part B, that's going to be your medical insurance that will carry a premium dependent on your 2 years prior adjusted gross income. So for example, if you were transitioned to Medicare in 2023, they're going to be looking at your 2021 tax return to determine what bracket you'll fall into for the premium payments. And that is going to be a 6 bracket that I would encourage anyone looking to transition to Medicare to look up online. Both of those by themselves are going to cover 80% of the cost for your care. And then that's where you get into either the supplement or the Medicare Advantage plan to cover that remaining 20%. So you have 100% coverage moving forward. And then the Part D plans, that's going to be strictly for your prescription coverage. So if you go with a Medicare A and B with a supplement policy, you'll need that Part D to cover your prescriptions, where through a Medicare Advantage plan, that's going to be something that is looped in. So you won't need a secondary Part D plan that's going to be included in that Medicare Advantage policy.
So it sounds like Medicare Part A and B, there's not really choice there. We got to pay for Part B based on income. They give us a good bit of things, but it's that supplement that's one of the choices that we make. How do people, what's kind of the range of offerings there, and how do you help folks go about evaluating the best supplement for them?
So with the supplement plans, that is going to vary by zip code and county once more. And then the main thing they're going to be looking at is going to be your age and gender as determining factors in the premium pricing. When looking at a Medicare supplement, there's going to be a wide variety of offerings from company choices. All your major players such as Cigna, Blue Cross, Farm Bureau are all going to be in that market. But the main thing to know is every single Medicare supplement plan is going to be federally mandated to offer the same exact coverage. So there's really no different in benefit between a Cigna supplement plan to a Blue Cross supplement plan. Furthermore, there's also no difference in network. When you are on original Medicare with a supplement plan, it's strictly if your provider accepts Medicare, they'll accept your supplement plan as well. So really, when we're looking at the Medicare supplement plans for clients, since benefit is going to be exactly the same, there's no networks between the companies. We're looking at price point as the determining factor. And really the best way to find that is just go site by site quoting based on age, gender, and zip code.
I mean, is there any factor that we would even look at with respect to service? I mean, it sounds like it's all the same network and it's all the same pieces, that are in play there. So is it just 9 times out of 10, it's just the price that we're looking at there among the providers?
Yes, that would be accurate. Some companies such as AARP will have like maybe a wellness benefit in there where you can get a free gym membership. So there is certain differences. And then there's also household discounts. So if you have husband and wife on the same plan, the premium would go down for that.
Let's talk Part D. How do we look at that choice? And are there any differences in maybe the way that we would evaluate that choice versus the way that we would think through a choice for supplements?
Yes, so when it comes to the Part D plans, each individual insurance company that offers these Part D plans have their own individual formulary list that they use to calculate the price of your prescriptions. Really, when looking at the Part D plans, it's all going to boil down to what medications you're on, what dosage you're on, and the frequency you're taking those medications. When you factor those in and compare them to the formulary list. We're strictly looking at what your cheapest overall price is throughout the year for those prescriptions.
And so it could be that Blue Cross differs very significantly in terms of where they put one prescription drug versus a plan that might be offered by AARP, it sounds like.
Exactly, correct.
Okay.
And then one other thing to note on the Part D plans is pharmacy choice is a major factor in that certain plans are in-network with pharmacies where others are out-of-network. Just as a example, I had a client who was on a medication that would cost them $5,000 at Walgreens and $40 at CVS. So that just shows an example of how important that pharmacy choice can be.
CVS is another quarter mile away from home for me, but I think I'd drive it,
Yeah, exactly.
Wow, so a huge difference there. Now, the formularies you talked about, so these are basically kind of ranking, where a prescription drug sits in terms of the cost structure of a particular Part D plan, if I gather. How often do these formularies change?
They change yearly, so it is very important that every year, if you are in a Medicare Part D plan, that you are rerunning that prescription list against the formularies of all the plans offered. I see it every year where there's major savings that can come into play depending on your medications. I do have some clients that change plans every single year and some clients who stay on the same plan year over year. So it really just depends on that area, what is being offered in the area, and then the formulary list of the companies.
So there can be a lot of movement there. It sounds like with the supplemental plans, though, that maybe that is a little bit more steady over time. Maybe people aren't changing quite as much with their Medicare supplement as maybe they might find incentive to changing in their Part D plan. Is that accurate?
That is correct. So with the Medicare supplements, we typically do not see many changes to those policies. The reason being is during your initial enrollment period through Medicare, your Medicare supplement is going to be guaranteed issue and instant enrollment. But if you try to change that Medicare supplement plan, let's say the next year during open enrollment, then the company can ask for pre-existing conditions and can deny you based on those pre-existing conditions. So up front, when you initially enroll in Medicare and you enroll in that Medicare supplement for the first time, you'll have no health questions asked. But if you try to move to a different company a year later, they can ask health questions and deny you coverage based on those questions.
If we think about Medicare, original Medicare, as we've called it here, versus Medicare Advantage plans, what would you say are the key benefits that going with the original Medicare option gives us?
The way I describe it to clients is your traditional Medicare strategy, which is going to be the Medicare A and B with a Medicare supplement and the Part D. That's going to be more of your buffet style plan. With that plan, you're going to be paying a higher premium, but the only copay you really have to worry about is the Part B deductible, which is $226. So the reason I describe it as a buffet style plan is you're pretty much paying this $226 deductible as your entrance fee. And then after that, it's all you can eat in the sense of pretty much everything will be covered at 100% following the payment of that deductible.
Whereas there may be, other challenges if we go towards what we'll get into the next episode, which is the Medicare Advantage plans.
Yes, that is correct. With the Medicare Advantage plans, it's going to be more in line with a traditional health plan where you're going to have these deductibles, out-of-pocket max numbers that are going to be, I'd say, in the 8,000 to 10,000 range on the out-of-pocket max. And you're going to have these set copays within the plan. So every time you see a primary care, it's going to be a $15 copay. Every time you have a hospital stay, it's going to be a $300 copay up into those out-of-pocket max numbers.
And if I gather as well, original Medicare, oftentimes you have a broader network of physicians that you can work with rather than some of the Advantage plans, which maybe you don't have quite as many selection options. Is that accurate?
That is correct. So with traditional Medicare, it's going to be strictly if your doctor accepts Medicare, they'll accept your Medicare, and that's anywhere in the country. With the Medicare Advantage plans, it's going to be your provider has to accept Medicare, but they also have to accept the Cigna Medicare Advantage plan. So you do get into that network. Many times I would say 99% of the time, recommend the PPO option. So you do have out-of-network coverage where if you're traveling out of state, you still get some benefit, but it will be hard that if you're in a Cigna Medicare Advantage plan in the state of Tennessee and you travel to California, you're not going to find many providers that accept that same Advantage plan in that area.
What about international travel? Let's just say, we've got a client that wants to take a trip to Europe. Does Medicare extend to Europe?
So Medicare does have very limited out of international coverage in place. Currently, it's really only for emergency situations. So if something were to happen, they'll pay 80% up to $50,000 in coverage. And then from there, that's really the only international coverage you're going to get from Medicare. So we always do recommend a international health policy to travel, and something we do look at here.
One of the key learnings there is original Medicare is great stateside, but we travel internationally. We need to add another layer.
Yes.
Well, I appreciate, again, all your insight. And for clients working with our team, the good news is that we get to work with Zach and his team on questions. So, whether you're headed towards Medicare and are looking at different options for supplement or Part D, or even the Advantage plans that we'll touch next time, or whether you're in the workforce and you're trying to evaluate different options that you have there, we have a team of experts that we work with in Zach and his teammates. And so again, Zach, thanks for carving out time to be able to walk us through the basics of original Medicare. Again, thanks.
Yeah, thanks for having me.
If you like these financial planning videos, please share it with a friend. And if you have questions, go to our website at SiriusRetirement.com. This content was provided by Retirement Planning Services. We are located in Knoxville, Tennessee. You can visit our website at SiriusRetirement.com. The information in this recording is intended for general educational and informational purposes only and should not be construed as investment advisory, financial planning, legal, tax, or other professional advice based on your specific situation. Please consult with your professional advisor before taking any action based on its contents. Advisory services offered through Retirement Planning Services, LLC.